thank you very much for coming along today, guys.
No worries.
Could you start off by giving us a bit of an introduction about yourselves and about your project and how you guys all work together and how you were introduced to Aero Health Club? Start with you, Carl.
So I'm Carl Scott. So I'm co-founder of Project Youth. We set up Project Youth, launched Project Youth in May 2023 of this year, with the aim basically just to work with kids in the community, try and get them away from serious violence or the risks of serious violence when it comes to the knife crime and other offences that young people are getting involved in these days. So the main aim really was around mentoring young people, strength-based really, and running workshops in schools based on the issues that young people are facing these days. It's like, social media and gang and county lines and drug dealing and such, so which all involve risks of serious violence. So that was the project. And yeah.
I'm Carla, I'm co-founder of Project Youth as well. So yeah, we had conversations, didn't we? The town that we live in is quite bad, it's getting worse. There's a lot of knife crime incidents down there. Me and Cole both got kids of teenage age. So yeah, that safety within the community is key to us. So as well as doing the stuff that we do with the project with the youths, we wanted to get involved with doing the distribution of bleed control kits. And that's kind of how we ended up meeting Dave.
Yeah, so I'm Dave from AED training. After I saw Carl and Carla on the news putting the first cabinet in Sussex and Hastings, I reached out and I suggested doing some free training for the community. And then that's how we linked up. And then before we knew it, there was a cabinet in Bexhill. Then we moved on to Worthing and Crawley, which was funded by the police. And then a couple of months after that, Cole and Carla were in London and they had a meeting, and after that they mentioned doing our own bleed kits, and that's how our partnership came about. I'd already known Greg previously from seeing the Rapid Stop on LinkedIn, so I've been following it for a few years, and then I met Sebastian as part of the trade team, and this is how the kit came together.
The best kit.
The best kit.
The best products inside.
Yeah. Give us a bit more of a deeper dive into what made you go into public access bleed controls and why you brought them out into the community to make them public access. I mean, it's a new thing, kind of, isn't it? Tell us about what persuaded you to do this.
I think it was we saw Kelly, wasn't it?
Yeah,
from Aero as well.
Originally, so what I was doing was a couple of years ago, because I've been doing this for about 5 years, but not visually like with social media, because we didn't have social media at the start when we was actually doing this stuff. So I was filming little documentaries for YouTube, and I was trying to integrate with parents that have lost kids, and that put me in touch with a lady called Kelly Brown who lost her son Romero West in Manchester. And I filmed her for a documentary. We did a walk through Manchester town centre, held up all the traffic with megaphones and stuff, knife crime takes people's lives, etc. And she was the one that discussed and mentioned about bleed control cabinets, which I'd never heard of. And I'd come back, and I'd mentioned it to Carla and an old friend of mine, and it was something that I thought, this is brilliant. It's a brilliant idea. How come we're only just finding out about it now?
It should be everywhere.
They should have been everywhere. So the minute that we found out about that, luckily, I was modelling for a clothing company at the time, and he funded the first cabinet. And that first cabinet was the starting point of where we started with the bleed control kits. And I think the whole reasoning behind the kits, where they are able to save somebody's life if they are involved in something catastrophic where they are potentially going to be bleeding out, then I wanted them up everywhere, and we made it our aim to get that off the ground. And it is in the position that it is now.
And the reason we did the cabinets is because obviously they're 24-hour access. So we've got the kits, but we're obviously the first stages of what we've been doing is getting those cabinets up so that they can be accessed 24 hours a day. And we have got aims to try and get the kits alone without the cabinet into pubs and clubs and stuff like that. We've got some going up in Brighton, haven't we?
Yeah.
So
we're going to be doing, so initially, like she said, we wanted to do the 24 access cabinets first. That was the first port of call because they're the bigger and the bigger part of in a town, just like defibs are as well. And then the next side to what we're going to be doing is following that through with putting the bags into venues, and we have got set venues that we are going to be putting them in, but I didn't want to do that ASAP because they're not 24-hour. So if we was to just concentrate putting these kits just solely into pubs and clubs at 1-2 o'clock in the morning, they close. But then you've got from, let's say, 2 till 6 o'clock in the morning where everyone's still drunk out on the streets, that something can happen, but unfortunately now they can't get the kit because they're closed. That's why we wanted to concentrate solely on the 24 cabinets instead.
And originally, when we first had these kits, we was actually buying kits with the things inside it wasn't everything that we've now got now. So when we teamed up with Dave's got a lot of background knowledge, haven't you, of all of the different things that are the best of the best, and that's how we've ended up getting to what we've got in our kits now.
No, definitely, yeah.
Dave, tell us a bit about where you come in on that. You're FREC 4 trained, are you?
Yeah, FREC 4 first responder and qualified trainer as well. Like I said, when I developed the relationship with Greg with the Rapid Stop, it was always in the back of my mind. And, there is other tourniquets in different kits. They're not as easy to use. And as much as we're doing bleed control training and other people doing training, there's also a big element of the first person that's going to come across someone won't be trained. And this is where the Rapid Stop, being so easy to use, it's a ratchet. A ratchet is an everyday item. Other mechanisms and tourniquets, you're not going to use that in every day. And ones with the windlass, when we do training, they ask, does it go left or do we go right? Well, when you've got a ratchet, it's a one-way system. You click it until the bleeding stops.
So intuitive, yeah. It's the most
Definitely.
intuitive tourniquet, perfect for public access bleed control kits, which is exactly what you guys are doing. So tell me about your engagement with the local communities. I know you do a bit of training, do you, for local schools and community groups and stuff. Tell us a bit about how that's going.
We've done 2 local free training sessions so far, haven't we? So what's that, about 30 people, I think?
Yeah, that was for members of the public, wasn't it, within our community?
30 people for free for the free ones that we've done, and we've also done professional services as well. I think all in all, over the last few months, we've trained over 100 people.
Wow.
We've run 2 workshops in a local school of ours. So
Yeah.
which age group was that?
That was year 8, year 10 and year 11s with bleed control training. And we've done probation service, we've done local
Well, we're just in Walsall on Friday.
We did Birmingham, Walsall, so we did a charity
Right
up
all the way there.
in Birmingham, so we trained them.
And they had they've got an issue there in Walsall, and they saw the training we've been doing, and Carl's background with gangs. That's what they wanted. They wanted people that are familiar with gangs, because that's the problem they have in the area. So that's why we did it, wasn't it? And they were really happy.
I think the point of doing it, because there was a lot of question around it, because a lot of members of the public was confused, and the sentence that kept coming out is, do you have to be trained to use these kits? And that was a big confusion. So because that kept coming up, that's where then obviously Dave would come in place, and we said about the training, and it'd be a good idea for us to actually train members of the public. Number one, so they feel confident in using the kits. But number 2, knowing that you actually don't have to be qualified to use the kits, because all the information that you need is in the box or in the bag, because there's instructions to tell you exactly what to do. But at that same time, you are going to be on the phone to the ambulance service as well. So you're covered in every angle. So there was a lot of people scared around it by actually touching it and not, wondering that they might do something wrong. But actually using the kit, or just standing there watching someone bleed out, you'd rather try and use something rather than just leave them.
We've also got Sussex Police. We've got a really good relationship, close working relationship with them. And for their Ops Sector Week, they invited us down, didn't they, to do like a community engagement day. So we had like a stall in the middle of our town, and we had like the kit on it and your equipment, didn't we?
Yeah, had it all out. Yeah,
and the members of the community got to come, just normal members of the public got to come over and have a little go with it. We did some demonstrations, didn't we?
Yeah.
Just to raise that awareness, and they was all really pleased with what they could see in the kits.
And one thing as well, we cover on the train, and we say a Category 1 ambulance call, they're meant to get there in 7 minutes, but if the femoral artery is cut, you can bleed out in 3 minutes.
Exactly.
So that's minus 4 minutes, which is once again why something like the Rapid Stop, which can be applied quick, with our Celox Rapid gauze, which works fast as well. That's why it's so important. We need to work on education, really, don't we?
Yeah.
Everyone knows about the defib and CPR, but when it comes to bleed control, there's not much awareness out there, is there?
No, and that's why we're out there and we're doing it. So it's really good that we've had so much news outlet publicity, because it has raised the awareness along in the southeast alone. It's raised so much awareness where at first there was a lot of stigma around it, and then no one wanted to touch it. No one wanted a box up on the walls. No one wanted to see it. No one wanted to talk about it. And the minute that we was on the news and the minute that we did Good Morning Britain, everything changed. And now everybody wants to know about it. And we get numerous phone calls and emails about kits that, can we supply this? Can we supply that? Can you come and train this? Can you come and train that? So the whole lot of publicity that we've had has been so beneficial.
We've actually got one kit going up tomorrow in Paternoster Square. So we've managed to get in with a big company called CIS Security from London. And they're on board with us now, and they want us to install a kit down in their area where they do their work. And with lots more to come afterwards, isn't there?
Well, this is where we've got our multiple injury person kit for terrorism, because Martin's Law, that should come out next year, and people are going to have bleed kits or training and stronger risk assessments for the chance of terrorism happening, which can happen any time. Knife crime is dominating with the bleed kits, but there's always that risk in terrorism.
Excellent. Yeah, can I just take you back to your training? What is your plan for the progression and getting as many people aware of the risks of knife crimes and how they can potentially save someone's life by using one of these kits?
I think to be honest with you, moving forward, the only thing that we can continue doing is what we're already doing.
Yeah.
I don't think there's much more that we can actually do. I think the more people that we train, the more people will be raising more awareness for us by publicly putting that out on their social medias, because it's through word of mouth and other people talking about where they've been and what they've done, that's where we get more contact, because it's really difficult trying to do this on your own. It's been hard. It's not been the easiest journey over the last year, getting this on the road and getting it done. It's been quite difficult. But because we've had more people talking about it and more people posting about it, that's where we've had so much more traction. So I think it's just continue what we're doing. We don't need to push it too much, because it's going nicely as it is. And like Dave said, we have got other plans. Like we've got the multi-injury persons bag as well, which we're trying to cover a different angle. So we're doing the knife crime angle for the single bag use, but then we're going to do the terrorism angle with the big bag. So because we're going into London, yes, there is a few of the areas within the estates in London that have bleed control cabinets, and have quite a few venues that do have the single bag use inside there, but nowhere has the multi-injury bags that are public access. So they might have them in venues, but then venues close. But when they're closed, what are they going to do with the kits? So we want these kits to be inside an exact cabinet that we're using for one of them. So in the event of a terrorist attack, or maybe even a gang fight where 4 or 5 people's been injured, they'll be able to access these bags.
Exactly, yeah. With the onset of Martin's Law that was spoke about in the King's speech just recently, are you finding more traction out of this law that's being passed through government for the demand of these kits?
We've had the conversation started, a month ago?
Yeah.
When it comes to these kits. So that's where then we all put our heads together again about, what can we do now? That's where we've come up with that. So luckily, we have been talking, as we said, with CIS Security, Head of Security PJ, legend, really good friend, and I did a talk at his counter-terrorism forum a few months back, and we've been friends ever since. And the angle that we're looking at, because of the Corporation of London, they're a big firm, and you have to follow a massive process to even get them on board. So there's been 2.5 months worth of graft to even get this kit up tomorrow where we're putting it. But now we're putting that kit up, we're possibly going to have probably about another 20 orders the minute that goes up.
Yeah, we've got quite a lot of people that have come on board with that. They think it's a brilliant idea, so we've got a lot of support.
Yeah.
The main aim I want, you've got to look at where the most likely areas of terrorism is going to happen. And we're looking at London Bridge, we're looking at Westminster, we're looking at all the big monumental places that this stuff is going to happen. That's where we want the kits. And then we can start branching them around, like Oxford Street, etc. The big places where Piccadilly Circus, you've got, what's the other place called? I can't remember, it's the big square. Trafalgar Square. We've got West End. I've already been contacted by someone from the West End who I've got a meeting with on Friday. So it's, again, word of mouth. They're seeing this stuff posted on LinkedIn and other social media platforms, and they're interested. and that's what makes them get in contact.
It's really
So-
surprising actually how many people have never heard of bleed control kits.
Definitely,
The
yeah.
amount of people that are, like, even in our own towns, like when we're putting these up, people are coming over. What's that? What's that big red box? What does that do? What's a bleed control kit? So it is just about raising that awareness and making as many people as possible aware of what they actually are and obviously how to use them.
And I think part of the problem from a training perspective, when we cover the tourniquets, people go, "Oh, didn't it used to be if it was on your leg for 15 minutes, you'd lose a limb?"
Yeah.
And some tourniquets, the instruction says, do not have on a leg for more than 2 hours. So this is part of the problem where people think, "Oh, I'm not a medic, I can't use a bleed kit." But the alternative is you watch someone die. Or as we say, if a person's not going to die on scene, they're going to die in the back of the ambulance, or they're going to die when they arrive at hospital. So every second counts, and that's the message we put out on our training.
Excellent, yes. And getting the cabinets in the places in London, like the high footfall, you'll get so much more awareness out there, won't you? Everyone will see it walking down the street, so that's excellent. Would you be able to tell us about your relationship with the Sussex Police and how that's helping you to bring these kits into the London area?
Well, 5 years ago, I was doing some volunteer work with Sussex Police under the restorative justice programme that they had. So I was speaking with quite a lot of young kids that was going missing from home. And a job role came up for a new intervention programme called Reboot, which was funded by the Crime Commissioner's Office. Worked on that programme for 2.5 years, all throughout COVID, going out supporting the most vulnerable kids that was obviously couldn't cope with the fact of being locked down in their house and not seeing anybody. That unfortunately lost its funding. But within that, the contacts that I'd built up throughout that period of time stayed with whatever I was doing moving forward from then on, which then obviously when we became to then set up Project Youth, them contacts were still there, wasn't they?
Yeah.
And I still had all the contacts at Sussex Police as well. I've got friends that work as police officers that are like response officers and youth prevention officers, etc. So I have that relationship, chief inspectors, sergeants, so when we've set up the project, it was kind of a go straight away, wasn't it? And then where we'd made so much noise with what was happening in our streets and the work that we was doing on the ground with young people, Sussex Police got on board with sorting us out money for the first kits that we put out under Ops Safety, which then Katie Bourne's office then contacted us because she'd heard that we'd been doing some training with the probation service and asked to attend. She then attended, and then we got personally invited to the Crime Commissioner's Office for a meeting with their side to see what we could do to help them as well, them to help us. So that's how that relationship was kind of really carried on, because they funded Project Youth just for activities for our young people to do, £8,000. So we've got a really, really good relationship with them, and she's really on board with what we do.
She loved coming along to the training.
She did, yeah.
A picture with her.
Yeah.
We're explaining how everything works, the tourniquet, packing the wounds. And I think what you said, going forward with training, because we've got such good support from the police and the Crime Commissioner, hopefully we can put more training on, can't we?
Yeah, definitely. And they pay for it.
It's great to have that backing, isn't it?
Yeah,
definitely.
Mm.
It should be mandatory in all schools. I think all schools should just be a part
Well,
of the
that's where
curriculum.
we like to go as well, isn't it? Going to
Yeah.
more schools.
Yeah, train all the kids, because you never know who's going to end up having to use one. So if it was just like first aid, like it's just like a knowledgeable thing that you can get the training on that quite easily. But with this, if this was something that everybody was just trained on, then it would be beneficial.
Yeah, because the sad thing with knife crime, the most recent deaths, you're talking about 15-year-olds and 16-year-olds and 17. It's not old adults like established criminals, it's young people that have picked up a knife, and this is why if we can train them in school, then they can save a life out in the street, can't they?
Yeah, we're not doing no harm, are we? Well,
Exactly.
what harm are we doing training young people? I don't understand what the major issue is with schools that aren't, accepting it or taking it on board. Like, it doesn't make any difference, You're just giving a young person more awareness, really. I mean,
And a set
we
of skills.
a set of skills. Yeah, when we work with kids, I know loads of kids that carry knives. So the chances are, unfortunately, like out of 10 kids, probably 2 of them 10 kids, 3 of them 10 kids are probably going to be in a vicinity when something like this happens. So we could have trained them 3 kids, but if they don't let us in, we can't. So then, unfortunately, them 3 kids are going to be in a position where they can't do anything to save their mate that's been stabbed, or even themselves.
Exactly.
So it's
They're teaching CPR in schools. Why aren't they teaching bleed control training?
100%.
Exactly.
Yeah.
It's such a good knowledge just to have that bit of knowledge. It's not everybody knows how to use a plaster. You wouldn't think twice about it. So if everybody just was familiar with all of these things that we've got in these kits, and it doesn't hurt anybody to know that, does it?
Well, that's what we say in the training. Like our chest seal, you literally peel it off and you stick it on. That's the same as a plaster, isn't it?
Yeah.
You take it out of the packaging, and if someone's got a hole, you can't really hurt them by putting a cover over it, the chest seal. So that's part of it as well.
Yeah, do you want to take us through your kits? Tell us about your
Yeah,
kits.
so the tourniquet, as you know, we've got the rapid stop, we've got the aero trauma dressing, we've got the Celox rapid hemostatic gauze, Celox chest seal, aero gloves, face shield, foil blanket, and the scissors.
So show us where we would use these in the situation, in a live situation. How would we use all these?
Tourniquet, we place that on the arm or on the legs. The hemostatic gauze, we pack that where we can't use a tourniquet, so armpits, up in the groin, base of the neck. And then chest seal, that's for penetrating chest wounds. That could be knife, bullet, shrapnel. So we put that over the wound.
So those two Celox products, they've got a special chemical, have they?
So the Celox Rapid, that's got the clotting agent in it. And like the Rapid Stop, that works in 60 seconds. And once again, going back to the cut femoral artery, if you can bleed out in 3 minutes, and ours takes only 60 seconds, we're improving the chances of survival.
Yeah, so I was just thinking, for those that don't know, the Celox products, they've got a special chemical on them that actually clots the blood, doesn't it? Which stops the bleed. It's an amazing piece of...
A lot of the other kits that you do see over different areas, they do have a hemostatic gauze in them, but that hemostatic gauze takes 3 minutes.
Yeah.
So the idea of where we've got the Celox Rapid one, our one does it within 60 seconds. So it's quicker than the others, which is why we like that product. And the same with the...
Tourniquet.
Gone completely blank now. If you've been
how many times do you say
I
that?
know, I was saying it so many times. It's because I just lost thought completely. You can carry on saying that.
So Dave, can you tell us about the chest seal and when would you use this? If you explain to someone that doesn't have a clue about first.
Yeah, so chest seal is a penetrating injury to the chest. So
someone's been stabbed in the chest or something like that. Yeah.
It looks like you literally peel it off and you place it over.
It's just like inside here. So you literally just open it up.
So the medical term when you've got the hole is a pneumothorax.
Okay.
But yeah, like I said, just like a plaster.
And it stops the air going in.
Yeah, it stops
So
the
it
air going in.
allows air to come out. So you've got to think about when anything goes into them sorts of cavities, the risks that come with that, like collapsed lung, heart attack because of the pressure and the stress that's going on with somebody's body. So but it's a really good piece of equipment.
And one thing with Celox, we say to people, this is what the military use. So like when we had our public engagement event, people are going, oh, what's a bleed kit? What's in it? And we say, it's got everything in it, chest seal, gauze, but this is what the military use.
Exactly.
So we're bringing the battlefield to members of the public. So this is why we're going to save more lives, because of the products we've got in them. And once again, going back to the rapid stop, it's so easy to use. And, we're going to just save lives with it.
Exactly.
And again, that's another reason why we wanted to set up our own bleed control kits, because a lot of the ones that you can get on the market, they don't have that equipment in there. And with that tourniquet, they use different tourniquets, which we don't feel as though they're as good as the one that we have from Aero.
Well, especially if you're untrained.
Yeah.
So why is the rapid stop tourniquet better than any other tourniquet?
It's easier to apply, which in a time critical situation, that's what you want.
It's inclusive of people that might have disabilities.
And that's another angle that we looked at. So, we try and cover every angle possible that we can cover. And I think at this day and age, there's a lot more people within in our community that suffer with disabilities. So it could be at some point that someone with a disability, maybe even arthritis in their hands, any kind of disability that they might have, that tourniquet there would be really simple for them to use if they was to come across someone that was really injured, rather than the other tourniquet that was originally inside the kit, which they'd actually struggle to use.
Can you explain why it's easier to use if you've got a disability? Dave?
You've got to look at it.
Yeah.
As in like the fact that you can do it
right,
right
so-
now. Lemon. Just I'm imagining these people are the people that have never heard of it before. Is what I'm saying. Basically.
Good idea.
So a really good feature with the rapid stop is the way you can detach it. So someone's got a trapped limb. You're not trying to struggle with the foot. So you put it on, pull it down, and then that's it. One finger. So in the worst case situation, someone could have their hand blown off by a bomb or shot. If you've got a couple of fingers, you can stop the bleeding. Where the other tourniquets, like the windlass, the bar, it can flap around. You might not do it tight enough. The other tourniquets where you have to keep wrapping it. That's a lot of effort to have to keep doing it.
It's time consuming.
Yeah,
exactly. Yeah.
Especially like if someone's in a car accident and they're trapped. Every time you're going to you've got to lift their leg, for example, to try and continually keep putting that around their leg. When with that, you don't have to. You just put that one bit over, connect it, and off you go. And it's as easy as that. So, yeah, we just try to cover every angle possible, and I think and I think that's what's impressed quite a lot of people that we've come into contact with, especially London, when it comes to these kids, because the ones that we're working with in London, they're all ex-military. They've all done Iraq, they've all done Afghanistan, they've been in the army for many, many, many years, and now they've become terrorism or counter-terrorism security firms that are looking after all the big monuments within London. So that's why they're so on board with what we've got, because of the kit that we actually have.
And on the training, so last Friday, we did training on a different bleed kit to ours, but I covered all the tourniquets that are currently in bleed kit. So there's 5 different tourniquets, I believe. And I went through, the one they've got in their kit. I went through the other traditional tourniquets, and then I showed them the rapid stop, and they were like, well, that's really quick. I was like, yeah, rapid. That's why we've got it. So
from all the training sessions that we've done, with all the feedback that we've had, everybody has preferred that tourniquet.
yeah.
They've preferred how it works. They understand the logics behind it. They prefer to use that one. It's easier. So, yeah, going on feedback as well as our own personal opinions.
Yeah.
Excellent.
We're really happy with all of our staff.
So we've covered the tourniquets and the Celox products. Tell us about the rest of your kit.
So we have gloves for personal protection. We've got the foil blanket in the event of shock, keep the casualty warm. We've got the face shield in the event of having to do CPR. And then the trauma dressing. So once again, with training, we do cover the other trauma dressings, but one thing people really like with your one is the clip. Because, Velcro can fail. The clip is really nice and secure. It's like a clothes peg, isn't it?
Yeah.
And that's another reason we have the aero trauma dressing in our kit.
Excellent. How is your initiative funded? You've already covered this, but how is your initiative funded, and what are your long-term plans? Just give us a quick one on that.
Funding. So it kind of works by donations, to be fair. Well, originally donations, where we're looking for donations from like other businesses or members of the public, which was proven to be really, really difficult. Luckily, I did a podcast with a lady from Knightsbridge tonight, and there was a lady that was a manager of a estate agent that heard that podcast on Spotify. The day that she heard it on Spotify while she was driving in the car was the day that she emailed me to say that she was interested in the bleed kit and wanted to donate. It was the day that she transferred the money straight away to my account. That was quick, wasn't it?
Yeah.
And that got us our Bexhill cabinet. And then from the Bexhill cabinet, we was filming with Channel 5 at the time, weren't we? And we got quite a lot of publicity around that anyway, with newspapers, etc. But I was already kind of in talks with the police as well at that time. So once we'd done that, the police was basically on board at that point. So going forward now, we have basically got big businesses as well as Sussex Police that are now putting a lot of money into what we're doing with these kits. And it's making us be able to do what we want to do.
After we had the police get involved, the council within our local council also got involved, and they wanted to buy some cabinets. So they donated the money for 4 other cabinets to go up around within the local area.
And training.
Yeah, and they paid for training as well. So they wanted to get people from the businesses that are situated where the boxes are, so where those 4 boxes have been put, businesses that are around those facilities, they wanted to invite them along to be trained. We've also just had Brighton Police have now got involved, haven't they? And they've funded for 6 boxes to go up in Brighton that we're going to be putting up probably into next year.
It's going to be January now,
And then they're paying for kits as well, aren't they? So not only the 24-hour access cabinets, but also some kits to go in pubs and clubs. So I think the more awareness that we manage to raise, the more on board different organisations get, which is more important. I feel as though it's more important that the police and the councils and stuff get on board as opposed to it come from funding from like smaller businesses.
Yeah, because the bigger companies, the statutory services, they've got more money.
Yeah, they have pots of funding within like community safety and stuff, and this is a community safety situation, so it should just be normalised and they should just be everywhere amongst all different communities.
I think if we can hit all the hotspots in Sussex and then branch into London, then that'd be a good goal, wouldn't it?
Yeah, well, we've already started. We're
Yeah.
hitting most of the points of the hotspots in Sussex. Like we're basically with Brighton, we've probably hit most of the main hotspot areas in Sussex, and because we was the first to actually initiate this program and this scheme within Sussex, that's what makes everybody like listen for what we're doing and want to get on board anyway, because no one ever heard of it before we actually branched out with it. So where we've kind of conquered Sussex with it, we are now kind of like leading up to London. So, but I will still be continuing to concentrate with Sussex because that's where we live. So London is another place and the next best place for us to be putting up the cabinets, because yet London is still close to us. It's only an hour's drive from where we live. So yeah, I think Sussex and London are the two main areas that we're going to.
And then more training, I would say, as we have so many kits up and untrained people, we want more training. So that's where it's good. We're backed by Sussex Police, and they were with us when we did the event with the council, and then we've got the Police and Crime Commissioner. So, and then we've got the partnership with Aero. We've got the support from Celox, and then we're moving into London, aren't we? Yeah. So it's all happening, and it's only going to get bigger, I feel.
Can you tell us about any saves that you've had with these kits?
None.
Luckily, none of them have been
Thank
used
God.
yet.
Yeah.
But they have all over the UK. They have how
I
many?
think about 22 people have been saved with public access bleed kits.
Okay.
Yeah, I saw one actually posted this morning. I think it was in Bristol. Someone was saved with a kit that was used up in that way. So they get used. And the thing is, why not have these kits anyway? I don't like, the stigma with, like I said earlier, we faced with these kits. It's just been like crazy. I just don't understand it. But when you've actually got there's proof in the pudding that like these kits have actually saved people's lives. Maybe, I do understand that not everybody's going to get saved by this. Of course they're not. And not everybody's also going to be saved by an ambulance service that's going to turn up when you're in Geneva. So, but still having them, there's still, you can still attempt to try rather than just like, jogging it on. Just watching, it doesn't make no sense. So that's been the hardest battle for us really, is getting everybody on board with it.
They say with cardiac arrest that there's nothing worse you can do to the patient. It's almost the same case with this, isn't it?
Exactly.
100%.
You're going to at least have a chance at trying to save the person. So having these kits out here will be...
Exactly.
I mean, on the training, we say, okay, we've covered the kit. What do you do if there's no kit around? And we say, if you can, go into a shop, ask for a first aid kit, triangular bandage, put that, pack the wound with that. The normal bandages are sterile, pack the wound. If you don't do something, the person's going to die. And
take your t-shirt off, get a belt, use just anything. But with these kits about, you don't have to run into shops.
Exactly.
They're there. They're public. They're in your town centres. They're in your shopping centres. So they are able to be accessed, and that's why we're pushing it.
And something we covered in our last professional training service was the PTSD on the police and ambulance service. Every week you're hearing of another 15-year-old that's bled out through a zombie knife. If we can stop them dying, then that's going to reduce the stress on the emergency services.
And normal members of the public Imagine being a normal member of the public and somebody's an accident, even a car accident could have happened in front of you, and then there's somebody that, it could even be a child that desperately needs your help, and they desperately need that for you to help stop that bleed. If you've got nothing and you can't do nothing about it, you're going to remember that for the rest of your life. But if there's a kit like this nearby and you can access it, get it, and potentially save that person's life, then that's going to be a hell of a lot less to handle in your mind than what it would be for you to live with that trauma of that person dying.
Yeah, exactly. At least you've done something to try and help them.
And this is where, Martin's Law, when it does come in, we're prepared. We've been doing these kits for knife crime. We're ready for terrorism to support people and save lives.
Dave, can you tell us about the two kits that we've got here? You've got a larger one and a small one. Tell us the differences between them, when you should purchase which one.
Yeah, so The individual one, as Cole said, that's more for knife crime in a bar, in a cabinet, in a hotspot area.
So this is the opened individual one,
Yeah,
is it?
that's the open one there.
Yeah.
And then we've got our multiple persons injury kit, which has 4 of everything. And the idea of this would be for terrorist attack, or like Cole said, if there was a big gang fight outside a club, you could have multiple people stabbed, slashed. So yeah, we've got 4 rapid stop tourniquets. We got 4 of the chest seals. We got 4 Celox Rapid, and then we've got 8 of the trauma dressings. There's 5 in this little pouch here, and then on the front we've got 4 of the foil blankets and the CPR face shields.
So this would go in one of the cabinets?
Yeah, it fits nicely in a cabinet. The idea would be a cabinet in a venue. You could have it in a response car as well.
Excellent. So tell me, if I've got someone that's been stabbed or shot in front of me, or there's been a terrorist attack, and I see a cabinet, what should I do?
So basically, so this is another thing. So let's talk about the southeast. So in the southeast, when we first had our original cabinet put up in Hastings Town Centre, we was under the impression that all NHS systems across the UK had a system in place that these kits can be put onto, so members of the public are able to get the codes. When we put up the Hastings kit, we found out the day after we'd done all the news and newspaper media promotions on it that wasn't the case. So no one in Hastings, if anything was to have happened that day, would have been able to get into that kit, because our NHS down in the southeast didn't have a system, and they said they wasn't planning on having a system in place. So me and Carla was panicking for about 3 days about what we're going to do, who's now going to be liable for this, because from what we'd read and what we thought that was going to be in place, we was wrong. So we was back and forth with emails and phone calls with Sussex Police of how we can get around this problem. So we've come up with another idea with Sussex Police. Sussex Police have now put a system in place where they have a system that if anybody calls from one of them boxes at that location, they will be able to give them the code to get into the box whilst transferring them over to an ambulance service. So that is the format that we've actually got. When these kits go into London Ambulance Service already do have a system in place. That's already ready to go. Our system's already ready set for when we go there tomorrow, so we don't have to worry about that. So with the planning on going forward for the future, we always now make sure that there is something in place before that's actually being installed, so we know we're okay.
And also it will tell you on the box, so on the cabinet, so in Hastings the cabinets are different, they say something different to the ones that are like in London. So in Hastings it will say phone 999, ask for police. And then when you ask for the police, you state the location that will be written on that cabinet, and then they'll give you the code and you'll type that in and you'll be able to open up the cabinet and get inside it. However, in places like London, you won't have to ask the police. So instead, you follow the instructions that's on that cabinet.
This is another thing. Going forward, we'd love to have a UK-wide system of bleed kits, the same as AEDs. So, I said there's several people around the UK doing this. We need to have all these kits linked up.
It needs to be like an app or something that's
An app,
created.
yeah.
That
Like
can
Google
just
Maps, for example.
Exactly.
So something like that actually shows all locations of exactly where these bleed kits are, and they do it visually on the internet. So then everybody can actually know, and there's like a system that goes in place. You bang that location into that app, and it automatically updates it, so everybody knows exactly where these things are.
I mean, hopefully with Martin's Law, that would be a requirement to have, this UK system linked with all the bleed kits.
So for defibrillators, we've got the circuit. It'd almost be
Circuit,
good to have
yeah.
something equivalent of this
Or
nationally.
another
across the
idea,
UK.
every AED cabinet have a standalone bleed kit in it, and then tick that box. So, yeah.
Thank you very much for coming and having this interview with us. We very much appreciate all the work you're doing and joining with us is much appreciated with our tourniquets and other products that you use. So thank you very much. Look forward
Thanks
to
for the
the
support.
partnership
Yeah,
going forward.
thank you for having us, and thank you for providing such a good tourniquet.
Yeah.
It's our favourite.
No worries. Excellent.
Brilliant, thank you.
Thank you very much.